Welcome to the Breakfast Leadership Show, where we interview global thought leaders on business, leadership, and life. Here's your host, keynote speaker, best-selling author, and chief burnout officer of the Breakfast Leadership Network, Michael Levitt.
Welcome back. I've got Tom and Rebekah on the line. This is going to be a great conversation. So Tom and Rebekah, how are you today?
Great, thank you.
Well, thank you.
Well, good. We're looking forward to this conversation for a while. You run a wellness organization that has a pretty specific focus. So why don't you share a little bit about the organization and we'll dive right into the conversation.
Sure. So I'm Rebekah. So Warren Wellness MD is a physician and PA run organization, and it initially started during COVID, just helping to keep, I think, our sanity as clinicians. And then it's kind of expanded to where we provide continuing education for healthcare professionals that need CME hours, but we do them primarily focused on mental wellness with the goal of adding adventure and family options to it as well.
It's so critically important. And as you both know, I used to work in healthcare for quite a long time. And I've been thinking a lot about my former colleagues over these last couple of years, because I know the healthcare sector as a whole is one that struggles with a lot of burnout, physician burnout, clinician burnout, and administrative burnout. And even in my own journey of my burnout as a healthcare executive, I know those problems were persistent. Then we throw in a pandemic, and wow, it just the numbers I was seeing, the countless hours. And again, with everything, and especially during the lockdown, most things being closed up or you have to order in or things like that. The one area that wasn't closed was healthcare. And they were overwhelmed in some areas to the point of, in certain areas, they were bringing in health professionals from other areas or across the globe to help out, just because the numbers that were being seen were just absolutely mind-boggling. And, the stress of it all is just so humongous. And I feel really horrible for everyone that's had to endure, this pandemic from a healthcare standpoint, because they're the go-to. That's where everybody was sent, either to get, treated, hooked up to ventilators or vaccinated or whatever the case may be. So, what were some of the things that you were seeing, with your colleagues, especially over these last couple of years?
So me specifically, and I'll let Tom talk as well. So me specifically, I was working on the COVID unit when all of this kind of started. I work in the hospital as a hospitalist. And so by default, all of these patients you hear about on the news were coming to see me or one of my colleagues. And then inevitably, a lot of them would end up in the ICU, which I didn't take care of the ICU ones at our hospital specifically. But I saw a lot of fear and chaos and trying to manage a huge society. You feel the burden on your shoulders, not just of your patients, because your patients are seeing this provider come in who's wearing plastic. There's no humanism to it. That we come in the room, we basically are having to come in and out because they say if you're exposed for more than just a few minutes, even if you have plastic, you're going to end up getting COVID and dying. So you're like, oh, great. So you're like, tell me real quick what you need. Okay. Oh, okay. All right. Bye. And then, there's no family visitors. And so you're carrying the weight of the illness of the patient. And as a clinician, you hear, we have limited data because it's such a new thing. And then this is back when it started. It's a little bit different now, but that you have the weight of the families because they're terrified. They can't see their loved ones. They don't know what's going on. So they're terrified talking to you. And then even in the beginning, the people in the hospital that weren't on the COVID unit were like, oh, we can't hang out with you. You're going to have to go to your corner. And so you're very isolated. So not only were you isolated from everyone, but you're also isolated by your colleagues that weren't caring for the COVID patients. And then you go home and are more isolated because they're on quarantine. And so it's a lot of isolation in the beginning. Fear led to a lot of reactive decisions, which led to a lot of kind of after effects that we're still seeing the wave of. It's gotten a little bit better with the numbers going down, but there's still a lot of effects from that secondary trauma that we were all just hounded with nonstop.
And Tom, your thoughts on that?
Well, I mean, it definitely was a potentially overwhelming situation. I was actually thinking if there was an upside, I guess, was the recipient of that. Was actually the mode with which we're using right now, which is the virtual technology. So, the ability to see a physician or a provider, by virtually was, it was kind of on the back burner, but boy, I tell you what, when this hit, it really pushed that to the fore, and I think it's something that people want, I mean, it's not applicable for everything, but I think it has been a useful resource, that was definitely propelled forward by the pandemic. So, silver lining, maybe.
Yeah, in Ontario, where I spend quite a bit of time prior to COVID, the way that physicians are compensated in Canada and in the Ontario government is they bill the government instead of billing an insurance company. And of course, there's billing codes like you would have in the States and whatnot. But as far as virtual visits were concerned, the compensation that the physicians were paid at the time was noticeably less than if the patient was physically in the same room with them. Well, one of the things that the government did right away once this all got squared away was, okay, we need to change that immediately. And I know it's a shock, but sometimes governments can move really, really fast. And they did on that matter to make sure, okay, we need to establish virtual connections. The physicians are going to be compensated properly for the work that they're doing. Doesn't matter if the patient's in the same room or across a camera. And that expedited a lot of things and made things better. And of course, now that is something like you had mentioned, a lot of patients want, and there's certain things that make sense, for, personal story. I, as a former cardiac, or actually I'm always going to be a cardiac patient because of my cardiac event that I had back in 2009. I have a checkup with my cardiologist going in for a stress test. And then we're going to have a virtual follow-up the week after. So I don't have to go to his clinic to sit in the room. We're going to have a chat across the screen, and he's going to go over the results. Everything should check out fine. I'm anticipating, but if something's amiss, then we can address it accordingly. But ultimately, that saves me as a patient time. That also saves administrative time for someone at the reception desk to check me in. I'm sitting in the waiting room, and even though we're kind of hopefully towards the tail end of COVID, cases are still there, and it minimizes exposure to certain things, and it keeps a lot of people safe. So again, that type of situation makes sense. If it's something where you literally have to see, down their throat or something like that. Most people don't have medical equipment at home where they can say, okay, say and unless they've got a popsicle stick they can use as tongue depressor maybe, but it may be one day. I mean, Amazon sells everything, so people could do that too. But ultimately, there's certain things that, virtual visits can help out, which increases access to care too. I mean, that's a bigger discussion for areas that have difficulty, rural areas for sure, that don't have access to as many healthcare providers as more urban settings do. So it has a potential to increase access to care. But going back to kind of the framework of the stress and the burnout of things like that, with all of this, it birthed your organization and it's one of those things where I like to say, and a good colleague of mine, Mark, tells me this phrase quite a bit. So tragedy creates opportunity. And you saw an opportunity that, there needed to be some type of resource for healthcare providers to be able to address their wellness and help with stress and all of that. So, when did the idea come about? I'm sure it was obviously during the pandemic, unless you were thinking about it beforehand. But, what were some of the lessons that you picked up along the way as you launched your organization?
Yeah, so we started, and this was probably more for my mental wellness, if you will, but we started in the very beginning, just having this Facebook Live from our bedrooms. I mean, not his and mine, but two separate houses because we're quarantined and I have kids. And so it's very crude. You can even go on the website. All the videos are there. Kind of awkward, whatever it's like from my bed. But we would talk about whatever, it was mindfulness or meditation or exercise. And we did, they're pretty solid conversations, not just conversations, but PowerPoint presentations on the physiology of exercise and stuff like that. So we did it every Tuesday. And then that kind of led to kind of a realization that my colleagues, there's probably 70 or 80 between physicians and, PAs, nurse practitioners, things that were just in our department that were talking about just not really being able to deal with how to process what was going on. And so we streamlined it more to, well, why don't we provide continuing education for this? Because we have to get hours every year and we're given money to get hours. So not a lot of, healthcare professionals like, hey, let's go talk about how traumatized I am from everything that we deal with. But if you say, hey, we're going to go on a 200-mile bike ride over 6 days, and we'll throw in some discussion of burnout, how to deal with it, how to make your work-life balance a little bit better, maybe a biker would be more inclined to go on that retreat or workshop. And the same with the beach one that we're having coming up. If we say, hey, bring your family to this, we're going to give you the afternoons where you can hang out with the family. We know that you're taken away from your family a lot, but we're going to give you some resources that can help you and your family, which is just as important, the people that you come home to, resources to deal with it. So we ended up getting credentialed, and it's through the Texas Medical Association, but we can use our education opportunity as well, not just in Texas. There are some stipulations, but really it's for anyone that needs to get the CME hours. So
that's a great usage of CME hours, because often it was, okay, go to this conference hall and you've got this big room of 8,000 people in it, and they'll feed you the steak dinner and all the good stuff. But then you're sitting in a conference room and listening, and okay, here's the latest development on this and that, and of course it's educating you on what's going out on there. But if I were a physician and I had my choice, I would say, beach in Florida sounds really good. And yes, I can bring the fam, and, they're going to be ecstatic because they're like a vacation, while you're, learning about some things. You can send them to, one of the amusement parks, or they can play at the beach or the resort, wherever it happens to be. And everyone's happy. They're like, oh, that was a great trip. And of course the doctor's going, well, at least you have the afternoon to be able to enjoy that too. Yeah. And because a lot of times those types of things, they're all day. I remember this is years and years ago when my oldest was 6 months old. I was sent out for a 2-week training session out in San Diego. And and my former wife and my 6-month-old, had an absolutely amazing 2-week vacation. There's beach pictures. They went to the ocean. They just went shopping. They had a great time. I'm inside
sitting in the room. I'm
sitting in this room getting trained on this asset management software platform. It's like, of course, that was before YouTube. But this could have been just done with videos. I could have watched them and been outside and did all that. But they had a blast. I had the evenings and the weekends, so it wasn't a complete write-off, but it was still one of those things where it's like, yeah, when you bring the family on conferences, like, are you actually going to get to see them? But sometimes, like you said, it's, well, here, let's go on a trip. It's paid for anyway. I had the couple extra tickets, and you guys can get some real vitamin D and play in the sand, and while I'm learning about burnout prevention, which again is critically important to this sector for sure.
Absolutely. And I think the big thing is part of what contributes to this kind of overwhelm with healthcare professionals is there are so many hours that are being worked that you're already being pulled from family. And so you don't really want to go to something and leave your family again, because it's work-life balances. That's not promoting a work-life balance. That's just continuing what's already leading to some of it. So.
the increased compliance measures, of course, with the Affordable Health Care Act, I know there was a ton of additional documentation that was required with that.
Absolutely. Mm-hmm.
I worked with a physician that practiced in the States for a long time before they came to Canada. And, he was running a huge medical facility just outside of Indianapolis. And he said he worked there for about 10 years. And he said the best month of billing that he ever got is that they were able to collect about 65% of what they billed. And it was just like a one-off type of thing. It's like, well, too bad you couldn't replicate that, because I know there's just constant chasing that, of course, charting, of course, you want to make some notes. And of course, with the volume of people you need to see, then you have to, of course, document everything in the chart. It used to be paper. Now it's electronic records, which the first, I'm not even going to get on that rabbit hole of a disaster.
That's
that
the favorite
is.
Discussion.
Yeah. And it's so funny because, and I used to work in software for a long time in a couple different types of industries. And it always alarmed me that when they were designing these things, that they didn't bother actually talking with the people that were actually going to use the system until about, the last 10th of the mile of the race. It's like, maybe we should have had those stakeholders in at the beginning, because that's not how physician-patient interaction even goes. And of course, that can vary. There's variances and how you practice medicine compared to Tom, compared to other people. Same principles, of course, but how you approach things, you may say, let's do this. I'm going to do this body of work first, and then I'll go back and chart. And sometimes it's like, okay, where do I click this? And of course, because it's a compensation-based activity as well, so you have to make sure that you're clicking the right check boxes, because otherwise that item that you would get, we'll say $200 for, if you check the wrong box, you're getting $50. You do that, 1,000 times a month. That's not going to be fun. So, and again, I'm not a physician, but I know all the problems. I heard about it, believe me, and some words that I'm not going to share on this show, but I heard them all. So I know, I do feel your pain. It's definitely something like that. So these retreats, I'm sure you're looking forward to them. If they, I don't know if they've happened yet, but I know they're coming up pretty soon. What's been some of the feedback that you've got so far from, the people that are signing up to go? I'm sure they're pretty excited about it.
Yeah, so the ones that we've had so far, we've done some smaller ones just because it took a while to get the credentialing in place. It takes about a year. And the ones we've had, we actually have had almost 100% of the people that have attended come back to our follow-ups, because we do a monthly follow-up for about 4 to 6 months with each one. And it's more of a check-in. How are things going? What are some challenges you've had implementing the information? And then it's really just a time to chat and collaborate with the people again. But people, when you have meetings at work, I can't say I attend every meeting that I'm supposed to, but these people have come to every meeting, and I really think it's because they found something that's investing in them that they know can help with their day-to-day and really just improve some of these symptoms of burnout, or whatever you want to call it, but this overwhelm that we're having, stress management, coping skills, and all of that. And we just recently had one, and the feedback was, this literally changed my entire life. We do have the ability actually to not just do group conferences, but we can do one-on-one. It's continuing education. But if it's somebody is really wanting to say, hey, I need focused education on coping skills or stress management because I'm a surgeon and everything is so intense all the time, or whatever it is, it's actually continuing education. We can do it as long as it's within the guidelines of what we're supposed to be providing from a standardization area, but we can do that. And so some of these larger groups have turned into kind of a smaller group environment, or even individual. And it's really actually given a new meaning to medicine and a new meaning to why they go to work. And it's been remarkable just seeing how it is. And also we just recently had one where one of the older physicians kind of took on a mentorship with one of the younger physicians that was struggling. And it's just really cool to see these kind of bonds and huge ripple effects is what it is, because they probably didn't know that was going to happen when they came to this event, but it's been really cool. And Tom's about to do a bike ride. I know he's really excited about it on his.
It's the stress or whatever, it seems like the kind of the natural response is to retreat and isolate. Ironically, that's probably the worst thing that you could do, And so I think that, that the meetings, the talks, whatever, they allow, like Rebekah said, a bond, it's a connection, and it's that interpersonal engagement, the relationship can develop that is actually therapeutic. I mean, it's not magic, so.
It's reconnecting, and unfortunately for so many of us, we all became isolated during this pandemic, and healthcare especially, and in many industries, but especially with healthcare professionals, there is many times where you actually feel like you're all alone in doing this work. Even though you've got peers, that could be in your building, there could be hundreds of PAs and physicians and nurses and clinicians in a building, but it's still, when you're feeling the overwhelm of all that's happening and not having necessarily the tools that you're aware of to address this stress and be able to kind of manage through it and learn some techniques to help you get through these things, which, what your work does. And congratulations, I should have said this earlier, on getting the CME accreditation. Yeah, that's not easy. I know they ask you for your DNA and the DNA of 18 ancestors before you, kind of thing. And that's for I understand why they do it, but still, it's not an easy task. But the fact that you did is going to impact so many healthcare professionals, because they're going to be able to get, one, their CMA credits, which they need to get, but also they're going to learn some techniques and skills that can help them rediscover the joy of medicine. And that's what I love seeing with healthcare professionals when they are enjoying what they're doing. And that's a skill. It's a gift, in my opinion. Again, having worked in the sector as long as I did, I feel it's a gift for those that do this, because going to medical school and learning all those things, not easy. That's a big commitment for people. And then practicing medicine and being exposed to someone presents, you're like, okay, what's going on? And they tell you, and you got to diagnose and look and study and research and all the things that it takes to be a healthcare professional. It is not an easy role, but the fact that your organization is helping these amazing human beings learn some techniques that they can reduce their stress and eliminate their burnout, so they can get back to the joy of medicine and doing things. So I commend you both for taking a risk, and putting in the time and effort when we're both, facing these challenges with your colleagues and launching this business. It's going to have such a huge impact on the healthcare sector, not only in the States, but across the globe. So where can people find out more about you and this amazing work that you're doing?
Yeah, the best place is our website is Warren Wellness MD. It's WARREN wellnessmd.com. And then we're on just the normal social media avenues, however it is. But there's all the information about the conference. And I would encourage, this is for healthcare professionals, but even if you're not going for CME, there's burnout through administration and different things like that may not get CME credits, but it's really just, it's information, I think, applicable to anyone. So if you're hearing this and you're like, well, I don't need CME, well, that's okay. You're welcome anyway. As long as you bring your family.
There you go. That's awesome. So I'll definitely have that information in the show notes. So Rebekah, Tom, thank you for doing this. Thank you for being on the show, and continued success with this very, very important endeavor that you've launched.
Yeah, thanks so much. You're so quick to get to talk to. We really appreciate it.
Thank you.
Thanks for listening to the Breakfast Leadership Show, part of the Breakfast Leadership Network. Visit breakfastleadership.com for tips on empowering your business and your life.